Welcome to Discovering with Dr. Deb. Our last season, we were discovering the Enneagram with Dr. Deb, and it was packed with a lot of information while also being a lot of fun to talk about and explore the Enneagram and why we do what we do. So go back and check out those episodes if you haven't seen them already. Here we are in season 2, and I'm going to be focusing on trauma and using EMDR therapy as a tool to help process trauma. My co-host for this season is psychologist Dr. Christie Sprowls from Austin, Texas. She has traveled all over the world to provide EMDR in humanitarian efforts, and she has also trained clinicians and providers in EMDR therapy. So get ready, let's dive right in and talk about trauma. Hello, welcome to this episode. Today we're going to talk with Dr. Christie Sprowls about anxiety and how EMDR helps with anxious symptoms. So we've been living through a pandemic. I know we've mentioned it in several episodes, but it's true. It's true. And I think there's been an increase. I haven't read studies. I'm sure they're out there. Anxiety has increased. Depression has increased. I mean, all the mental health issues have definitely been affected living through the pandemic. Anxiety, though, it can look like a lot of different things. So a lot of people just think anxiety is just feeling nervous. So maybe first we could kind of talk a little about what anxiety is and how it presents, and then maybe how EMDR can help address anxious symptoms. Okay. So anxiety, when you look at the DSM, there's anxiety disorder. Mm-hmm. There's generalized anxiety disorder. It can result in OCD tendencies, obsessive compulsion, and post-traumatic stress disorder. So it looks differently for different people.
Yes.
Most, I would say, really have generalized anxiety disorder. Mm-hmm. What do you see in your practice?
I tend to see people, not so much, we shorten general anxiety disorder down to GAD.
GAD.
Yeah. The GAD doesn't come in all that often, although I work a lot with students from UT.
Okay.
So that does present itself. But usually they're like one step worse than anxiety. And it's really kind of interesting. And panic, too. I don't know if we want to talk a little bit about panic. But
that's a good idea.
And phobias. I think sort of wrap them all around. But anyway, anxiety.
Yeah. See, in private practice world, we see a lot of GAD.
Yeah.
We do see a lot of GAD. Yeah.
Okay. I'm primarily, I'm known for EMDR. Right. So really people are coming to me.
A little higher level.
A higher
exactly.
level. Exactly. Maybe they've tried a lot of different things that hadn't worked. Maybe talk therapy. Maybe even, response prevention, right. All kinds of things.
Well, and they've tried grounding exercises, exposure therapies, and they still have anxiety.
That's right. That's right. So it's very interesting. How does anxiety show? It can be anything from, we call it sort of student mind, where you are enclosed in a room and you're studying for 15 hours and then you have to go to the grocery store to get something, and you kind of walk in and you start noticing this is anxiety producing. Whoa, There's people out here.
Right.
And there's a lot of activity when I've been in this little column of quiet.
Okay.
Right? So that happens a lot. But then, it's interesting because the anxiety can go to all different areas. It can go to, I'm anxious, I'm having test anxiety, I'm anxious. I don't really like it to get on the elevator, which, starts getting into different types of anxieties and phobia. Yeah. And so, as you said, it shows up differently for each person. The cases that I think about talking about when I'm working with anxiety, and it can bleed into other areas, as you were saying, it can bleed into OCD, it can go into, panic, that kind of thing. And that makes it even more complex. Straight on anxiety, we're working with EMDR on it, is again, I'm going to ask them, where did you first experience anxiety? How old were you? What happened? Well, I was on the playground and some little boys surrounded me and started making fun of me and poking at me, and it made me anxious, and then I never wanted to go back out there.
Sure.
Okay. All right. So, and how old were you then? I was about maybe 8. Okay. All right. 8. And we begin to trace it back.
Okay.
So then we're looking at first, worst, and most recent experiences with anxiety.
First, worst, and most recent.
That's
Okay.
right.
Okay.
And
really, these are all traumas.
yes. Yeah, that's right.
Yeah. Do they call it that? Or do they?
No.
I didn't think so. Okay.
Yeah,
Isn't that interesting?
Yes, it is.
Yeah.
Because
okay.
That's pretty frightening. You're a little
right.
girl,
So the anxiety is a trauma response.
Mm-hmm.
Okay.
It can be.
It can be.
Also,
It can be.
It
Sure.
can be taught by anxious helicopter
Oh
parents.
gosh.
Mm-hmm.
Yeah.
Happens
And
all the
we're
time.
seeing more of that.
Yes.
Yeah.
It's interesting. Parents are so much more involved in their children's life,
Mm-hmm.
and they can teach anxiety. So this is the examples that I like to use. Well, when I was a little kid living in Africa, I lived on the Indian Ocean, and there was this huge cliff. They called it Ladder's Cove, and I used to go there, and I would jump off the lower rings on the ladder. That was a lot of fun. And so I thought, well, a little height.
I'm a little jealous.
Okay, so, yeah. And so then it became, a few more rungs up the ladder,
Yeah.
a few more rungs up the ladder.
And before you know it,
Top of the cliff.
oh, there you are.
Okay. So these parents, I don't know why, they said to their children, don't do what Christie does. By all means, you might jump off the ladder and break a leg. You might hit your head. You might do such and such, right? So it was like, it started, and in Africa, let me tell you, there's like worms that can go up your foot and then go into your heart, bilharzia, and you die. So, there's lots to be a little bit anxious about.
Sure.
You have to be cautious.
Sure.
So but what they did by doing that was, unfortunately, sort of beginning to lay the landscape for anxiety. Look at all the horrible things that can happen to you while you're here in this country, and you must not do that. And by the way, we think you're not going to hang around with that Christie girl.
She'll lead you astray.
She will lead you astray. Well, and I have to tell you, I just recently went back to Africa. I was doing some work there and also playing, but I went to my cove, and I thought, I jumped down. Where?
Now that was a little anxiety producing. I have no doubt.
I tell you, I was like, whoa, they were right about this. But anyway, okay, so that's just like one kind of anxiety.
Yes. That's how it's taught.
That's right. It's taught.
Right.
Right. Or you have a really anxious parent.
Right.
And they're so anxious, like they can't hold you, that they can't manage their own anxiety, that they're over here. Then the last one I want to tell is a funny story about another student. So the student, while I was a student at UT studying anxiety, the student came in and he was like this. And forgive me for my antics, but this is how I teach most of the time. Okay. He comes in and he has his book. I thought, well, come on in, sit down, okay? I mean, he was just like hovering.
Yeah.
And he says, I'm so anxious. I can't study. I can't focus. And it's interesting, but he suddenly pumped my anxiety up, right? So I'm sitting there going like, okay, you can't study? Okay, we'll read this. Okay, well, so he leaves instead of just with this. He's got a pile of paper. And I say, okay, I'll see you next time. And don't you worry, all this, because it bleeds into me.
Yes.
And I was like, I didn't help that guy one little whit. And
yes.
Because I just fed off his anxiety.
Right. It rubbed off on you.
That's right.
Yeah.
So going back to first, worst, and most recent. So that's where we'll start. When was the first time? I was 8.
Yes.
At the playground. The next time was, something like I had to do a presentation in high school. The most recent time was that I had this professor ask me a question and I didn't have the answer. And everybody in the classroom laughed at me.
Yes.
Okay.
Yes.
So that's kind of straightforward.
Sure.
Right? And we'll work on from the touchdown, we call it. So the bottom where it started up into the present.
Okay.
And we'll desensitize all of that. And then we're going to move on to how do they want to be thinking, feeling, and behaving in the future.
Okay.
In these same situations.
Right.
So that's a very short little nutshell.
Right.
Of how we do it.
Right.
For anxiety.
But that also kind of brings up the whole, they have EMDR, past, present, and future.
Yes. Okay. Yes,
okay.
Absolutely.
So we can touch on that a little bit.
Okay.
So you said helping them to see how they want to feel, act, and whatever the other one was. Behave in the future.
That's right.
So that's the R part of the EMDR.
Yes. Well, future. Yes. Well,
kind of.
Yeah.
The reprocessing. We've reprocessed it.
Yes.
And then there's future template.
Yeah, you reprocess it, and there's other phases in between, and then you just have them have this idea about how do they want to be thinking, feeling, behaving in the future, and then they will do that work so that when they go back out, whether it's public speaking anxiety or whatever it is, when they go back out to do the thing that they are afraid of doing, which, by the way, requires a lot of courage. We're asking them to do things they don't want to do. So I send them out. We do a little future, what we call the future template, and then they have to do it, do the thing, and come back in, and then they tell me what went well or what didn't go well. Whatever didn't go well, we focus on.
Would this work for imposter syndrome also?
Absolutely.
Yeah.
Absolutely.
Wouldn't this be great for like programs?
Yes.
To be able to offer that to their students, because I know in the counseling field, and I teach full time too in the clinical mental health program, and my intern students all, not all of them, but a lot of them will feel, I'll read it in their paper, they feel like I'm sitting here with a client and they trust that I'm going to be able to help them, and I don't know what I'm doing. You know, they have imposter, and a lot of them will label it imposter syndrome.
Yeah.
And it's interesting because I had a student before who was a pharmacist, and she said, they don't let you out into the world of pharmacy unless you know what you're doing. And here we don't really know what we're doing until we start practicing it. That's true. It's an entirely different thing. You're like, it's the same thing with physicians. Like, you don't want a surgeon who's like, well, let me just try this out. See?
Yeah. Not sure if this works.
So, I mean, but it's a real thing. But I could imagine the future template too would work with that, because there's anxiety when you don't think you know what you're doing, whether you do or not.
Yes.
So that would work too for that.
And you would probably want to think about, where did it start? Just like that first, worst, and most recent.
Sure.
Because the first would be possibly somebody telling them something that they weren't performing well, or just being unfortunate in the field. It used to hurt my feelings a lot. We had a psychiatrist, and when I was getting my doctorate, and during my clinicals, and he was just mean, you know, and you were like, oh, I mean, that's just so mean, and that's how they are, like, forever.
Yeah, that's how that happens in med schools.
Yes, exactly. I mean, that psychiatrists, right? So med school. Yeah. And we're not accustomed to that.
No.
Our world, right? I can imagine.
We're softer.
Yeah. Maybe why we chose what we do.
Yeah.
I'm not sure, but anyway.
Interesting.
Yes.
So then they come back after they've tried the thing that they didn't want to try, and they really had to have courage to just, get out of that nest and fly.
That's great.
Right? So they come back and they kind of report what worked, what didn't work, and then you're just going to do more bilateral stimulation on that.
We process what was difficult.
Okay.
Yes. And then they go out and they do it again, and we repeat that cycle over and over until they're able to do it without any side effects, any anxiety. Well, other thing I tell people when they're coming in for anxiety, they go, I never want to be anxious again in my life. And I'm not going. I say, listen, that's kind of an impossibility.
Sure.
And anxiety is a good thing. It lets us know sometimes. Well, there's something dangerous.
There's something
coming.
Right. It's a protection.
It's a protection. Or it could just sort of amp you up. I talk about the Yerkes-Dodson. You might remember that the curve where if you have this much anxiety, you'll perform your peak performance. If you have just this much more anxiety, you're not going to be able to perform as well, right? So we want some anxiety to help us perform well.
Right. And athletes are aware of that. Athletes understand that. And they sometimes they don't necessarily have imposter syndrome, but they will have sometimes performance anxiety.
Totally.
But helping them to understand, like you just said, some anxiety is good, but too much is not good. Too much is too much.
That's right.
Right.
It takes away your ability to perform.
Right. Right.
So we're looking for the fine middle ground.
Right. In between here and here. Sure. Okay.
Yeah.
So what about panic attack? You kind of alluded to that earlier, and you have clients that come in like, I had a panic attack this last week.
Yes.
How do we do EMDR with those folks?
Okay. Again, funny stories about these things, but so I kind of go back, panic. I go back and I think about this gentleman who was actually my hairdresser, who told me, this was before I was a therapist, told me that he had suffered a lot with panic attacks, but that he learned to manage them himself. I thought that was a very interesting concept, and that he could talk himself out of having a panic attack. Well, lo and behold, I became a therapist, and I had not experienced a panic attack before or anything at that time, and so I thought, well, that's a very interesting concept, and that's exactly what we kind of do with them. First of all, we'll work on the first time they had the panic attack, what was going on.
Gotcha.
Maybe a student, again, going back to student, well, I actually smoked some, marijuana, and I got drunk, and then I woke up in a panic attack, which often that happens, is it'll bring on a panic attack in people. It might be, whatever it is that brought on the panic attack. And what's so horrible again about a panic attack is that it just comes out of the blue. You're walking around and you're minding your own business, and bam, something hits you, and also, you can hardly breathe. You don't know how to manage it. You think you're going to die. So there's so many stories. It's hard to pick one to illustrate for you. But a good example would be another person who was having this panic response. She was a nurse. She was learning to become a nurse. And she panicked anytime anybody would call on her, or, as they do, like the doctors and that kind of thing. And she also became phobic about actually needles and blood.
Oh, interesting.
Nurse.
Yeah, that's going to be tough.
So we go back in time, again, first time this happened.
Right.
Well, and this is a sad case, but her mom got hit by a car in front of her, which resulted in her ultimate death. And so we had to reprocess that trauma. So sometimes anxiety comes from trauma.
Right,
Okay.
right. I can see that.
Which is what you had just said. So we reprocessed that, and she was, feeling like, okay, she was having her anxiety more under control. And we, at the same time, we're sort of focusing on the phobia. So it all wrapped up with that trauma, all right? Then we had her go in and stand by where she was in the operating room.
Okay.
And see the blood, and she would keel over. She would faint.
Oh, wow. That was pretty severe.
Yeah.
Yeah.
And also the anxiety just about leading up to having to show up and do things in front of people, and everybody's going to make fun of you and laugh and all of this stuff. So it was pretty interesting and kind of difficult. But we just inch our way up in helping her to deal with the panic and however it showed up.
Right.
And how to do her own internal talking to herself about how do I want to be thinking, feeling, and behaving, and desensitizing every time she would go back out. How did you respond to the blood? How was your anxiety? How was your panic? And slowly but surely get the panic under control. When I talk to them about panic and anxiety, I also am teaching as I go, and I will let them know that you actually can control your body, going back to my hairdresser, by changing your sympathetic and parasympathetic nervous system by just doing diaphragmatic breathing.
Oh,
boom.
Okay.
I mean, it tells your brain, you turn off right now.
Oh.
So I teach them how to do that, and they kind of go, what? Because it actually it actually really works.
Yeah.
Your body can't be anxious and relaxed at the same time.
Right.
Okay.
Right.
And it can go into a panic attack if you're relaxed.
Right.
So that's how we go through it, and we're doing bilateral stimulation
Okay.
on anything that needs bilateral stimulation. Then they have to go out and tell me again in the future those situations. I mean, this is very nuts and bolts. Very
Right.
quick.
This is basic.
Yes.
This is
Basic and fast.
Right.
This is like a 2-day presentation.
Right.
But that's kind of it.
Yeah. Yeah.
And phobia is the same.
Phobia is the same. Sure. Yeah, that would make sense. Yeah. So when they think back to like the first and then the worst and the most recent, are you doing the same? You're doing the image, the negative cognition?
That's correct.
Okay.
Yeah.
And level of disturbance.
Yes.
Right.
And where you feel that in your body.
Where you feel in your body. Right. What emotions does it bring up? Okay. So the full EMDR.
Yeah. Yeah.
Yeah.
You're really doing the full EMDR and whatever they present with.
Whatever they present with. Right. Yeah.
And it metamorphosizes if that's the right way to say the word.
I wouldn't know.
But it changes over time.
Okay.
Okay, and so the target changes each time they come in. It's not really changing. You're still using, well, that's probably too in depth, but yeah, you still are working on the
Right.
first thing that,
Right.
that's bothersome.
So for anxiety, it could be a previous trauma.
Yes.
It could just be something going on that is unsettling,
Yes.
but you're going to really do the same EMDR with them regardless.
That's right.
Right. Yeah. And I think you're right though. And we talked about myths about EMDR in another episode. And that's one of the myths, is that it's really just used to target trauma.
Yeah.
But here we're talking just about anxiety, the umbrella of anxiety disorders, using it for, we didn't even talk about like OCD, but it's the same thing. I would imagine you're going to go back the first time you noticed having those obsessions or compulsions.
That's correct.
What was going on. And then the most recent, and then the worst.
Yes.
I did it backwards.
Yeah, well, you can pick. You can kind of pick. Once
Right.
you get to be an advanced EMDR clinician, you can decide where to go.
Which you're going to target
That's
first.
right.
Right.
That's right.
Yeah.
And then with them, you do a little more exposure with response prevention.
Okay. Sure.
And I'll just say something about that quickly if we've got the time.
Absolutely.
Okay. So for them, we do everything we do for everybody, but then they have to say they are afraid that they've left the pot on the stove lit,
Yes.
right?
Yes.
And they have to go every day. It takes about 30 minutes for them to leave the house because they
Have to go back to make sure it's turned off.
That's right.
Right.
And then they get down the
'Cause they
stairs
have
and in the
that
car, and then they go
obsession.
back upstairs, and there's so it's until they can finally make themselves drive away.
Right.
So we start putting on the pot, and it's on, and it's full of water, and by the end of this, they're going to be using a really big pot because we make them go down to the street corner and have a cup of coffee while it's on.
Oh.
So we're having some exposure and then response prevention.
Okay.
Right? They can't go back.
Okay.
And then you do bilateral stimulation
Okay.
on them. So anyway, that's again.
So you're addressing the compulsion that they have and the obsession and right.
Mm-hmm.
Interesting.
Got lots of stories about all of those.
Lots. Yes.
Well, you can imagine 35 years of
Right. Yeah, so that's interesting because, like I said, a lot private practice world, a lot of GAD, a lot of depression disorder. We're going to have depression in another episode. Talk about using EMDR to target depression, but I think too it goes back to like you can use EMDR with so many different, not even issues. I mean, some mental health issues, but also just situations
Yes, and different diagnoses.
and different diagnoses. So,
You know.
all right. So that was just dipping our toe in,
That's right.
talking about anxiety and EMDR. Hope you enjoyed it. Hope you learned something new. And we'll see you in the next episode. If this content has been helpful to you, I'd appreciate it if you would please rate the podcast, post it, and share it on social media. And also post a review. If you'd like to get in contact with me, my phone is 479-561-7600. Or email Dr. Deborah at anchoredhopecounseling.net or Dr. Deborah at drdebfordoctors.com. Our website at www.anchoredhopecounseling.net has some useful information, and you can also reach out to me through the website. Remember, you are enough just the way you are, and you are loved.